today we'll see the dissection of the back. First we should give one midline incision from the external occipital protuberance to the T12 vertebra. How you will know T12 vertebra? So you already know the lower border of the scapula is present at the T7 vertebra. So from here 8, 9, 10, 11, 12. So up to from here to here. External occipital protuberance to the T12 vertebra, one incision. And one more incision is from T12 vertebra to the tip of the shoulder joint. Okay. So now we will remove the flaps. So after removing flaps, so this muscle is the trapezius muscle. In the muscles of the back, the superficial muscles are the trapezius and the latissimus dorsi. I will tell you clearly. So one of the muscles of the back is the trapezius. Okay, this is a shape of the trapezius. The two flaps of the trapezius muscle will give a shape of the trapezoid. That is why the name of this muscle is a trapezius. Actually, the trapezius will have upper ascending fibers, medial fibers, and the lower upper descending fibers, middle horizontal fibers, and the lower ascending fibers. So all these fibers will be inserting into the upper part of the spine, upper lip of the spinous process of the scapula. So here you can see the spinous process of the scapula. This is the acromion process of the scapula. This is the insertion of the trapezius muscle. Origin is from here, middle fibers from here, lower fibers from spinous process of the all the thoracic vertebra. Okay, all these fibers will be inserting into the upper lip of the spinous process of the scapula. After removing the trapezius, so coming to one more muscle of the superficial part of the back. This is the latissimus dorsi muscle. It is also the broad muscle, so it is originating from the this is the thoracolumbar fascia you can see here, and also it is originating from the iliac crest, and all this will be inserting, it will go laterally and will be inserting into the bicipital groove along with the other major muscles like pectoralis major, teres major. Okay, you can remember it as a lady between two majors. Okay, latissimus dorsi muscle insertion into the bicipital groove. This is the latissimus dorsi muscle. So now I am removing the latissimus dorsi also. So coming to the other extrinsic muscles. Can you see one more flap here? So this is the serratus anterior, serratus and posterior inferior muscle. You know there is a serratus anterior muscle laterally. Same as serratus anterior, you will have the serratus posterior muscle, which is again divided into serratus posterior superior, serratus posterior inferior. Serratus posterior I will show you after removing major minor muscles. So this is the serratus posterior inferior muscle. Serratus posterior superior muscle will be here. This is the serratus posterior superior muscle. This is the serratus posterior inferior muscle. So here just below the trapezius muscle, these muscles are the levator scapula, rhomboideus minor, rhomboideus major. Okay, these two muscles are attached to the medial border of the scapula. Okay, inserted into the medial border of the scapula. Rhomboideus minor is very small. So just below, in between the levator scapula and the rhomboideus minor, in between the levator scapula and the rhomboideus minor, you can see one artery. This is the transverse cervical artery. So this transverse cervical artery is a branch of the thyrocervical trunk. Okay, this will take part in the formation of the anastomosis around the scapula. Okay, so thyrocervical, this is a branch of the thyrocervical trunk. Thyrocervical trunk is again a branch of the subclavian artery. You can remember the branches of the subclavian artery as vitamin C, D, VIT, C, D. So this is the branch of the T. VIT में T बोले तो thyrocervical trunk. Okay, and one more thing, just at the lower border of the levator scapula, you can see the dorsal scapular nerve. Okay, this nerve is supplying the rhomboideus minor and major muscles. So dorsal scapular nerve is a branch of the trunks of the brachial plexus. Okay, from the trunks you will have the roots of the brachial plexus. From the roots of the brachial plexus you will have the long thoracic nerve and the dorsal scapular nerve. Okay, so these are the nerves and the vessels present between the levator scapula and the rhomboideus minor and the major. Coming to this side, this is latissimus dorsi, you know already. And here above the spinous process, this is the supraspinatus muscle. Below the spinous process, this is the infraspinatus muscle. And this is the teres minor muscle. This is the teres major muscle. And this is the long head of the tricep. Okay, and this is the medial head of the tricep. This is the lateral head of the tricep. Okay, these are the three heads of the tricep muscle. So this is the long head, minor, major. There are some spaces present in between these three muscles. So this space is the upper triangular space. Okay, so the borders of the upper triangular spaces, one is minor, one is major, one is latissimus dorsi. And the contents of the upper triangular spaces, can you see here? This is the circumflex scapular artery. Okay, I will also show this circumflex scapular artery coming after removing the infraspinatus muscle. So this circumflex scapular artery is a terminal branch of the subscapular artery. Okay, subscapular artery is again the branch of the third part of the axillary artery. Okay, this is the triangle. Okay, this is the triangle, minor, major, long head of the tricep. And can you see there is a quadrangular space here? See, there is a quadrangular space here. So the borders are, one is above minor, below major, and this one is the long head of the bicep, and lateral side you will have the humerus bone. Okay, four borders, minor, major, tricep and the humerus bone, especially long head of the tricep. And coming to the contents of the quadrangular space, you will have the deltoid nerve, axillary nerve. Okay, these are the anterior and the posterior branches of the axillary nerve and the posterior circumflex humeral artery. Okay, actually axillary nerve is divided into anterior and posterior branches in the quadrangular space. You can see clearly. This is the anterior division, this is the posterior division. The anterior division is supplying the, so this is deltoid muscle now. These are the middle fibers of the deltoid, posterior fibers of the deltoid. Here anterior fibers of the dorsal, you cannot see clearly, but here you will have the anterior fibers of the deltoid. So this anterior division of the axillary nerve is supplying the middle fibers of the deltoid muscle. This posterior division of the axillary nerve is supplying the posterior fibers of the deltoid muscle and also the teres minor muscle. So this is the branch supplying the teres minor muscle, and this is the branch supplying the posterior fibers of the deltoid muscle. And this posterior division of the axillary nerve will continue, will merging with the deep fascia, and it will continue as a upper lateral cutaneous nerve of the arm. Okay, upper lateral cutaneous nerve of the arm. So these two are the anterior division and the posterior divisions of the axillary nerve, and this is the posterior circumflex humeral artery. These are the contents of the quadrangular space. Coming to one more space. So coming to one more space, this is the lower triangular space. Okay, the margins of the lower triangular space is long head of the tricep, and lateral border is humerus bone, and upper border is the teres major muscle. This is major muscle, tricep muscle, long head of tricep, and the humerus bone. This is lower triangle. And the contents of the lower triangular space is, one is radial nerve and one is the posterior profunda brachial artery. Okay, you can see clearly here, this is the profunda brachial artery, this is the radial nerve, and these two are directly related to the spiral groove of the humerus bone. So these are the muscles and the spaces present in this area. So now I will remove the infraspinatus also. So this is supraspinatus, infraspinatus muscle now. So when I remove infraspinatus muscle, you can see the suprascapular nerve. Okay, suprascapular nerve. So this suprascapular nerves and vessels. You can also see the suprascapular artery, suprascapular nerve. So this suprascapular nerve is supplying the supraspinatus muscle and the infraspinatus muscle. So this suprascapular nerve is coming from where? from the trunks of the brachial plexus. The other branches from the trunks of the brachial plexus are the nerve to subclavius. And here this is the dorsal scapular nerve. Dorsal scapular nerve is supplying the rhamboides minor and the rhamboides major. Okay. If I remove the minor and major, you can also clearly see the dorsal scapular nerve. So this dorsal scapular nerve is a branch from the roots of the brachial plexus. Okay. This suprascapular nerve is a branch from the trunks of the brachial plexus. And here you can also see the suprascapular artery. And here this is the circumflex scapular artery. Okay. This is the circumflex scapular artery, which is also the content of the upper triangular space. Okay. Here. This is the circumflex scapular artery. Here also you can see circumflex scapular artery. Okay. And below the scapula you can see the subscapular muscle. Okay. Subscapularis muscle. One more thing I forgot. So when I remove the deltoid muscle, here you can see the spinal accessory nerve. Okay, spinal accessory nerve. This is nothing but the 11th cranial nerve. And also you can see the dorsal scapular artery and the dorsal scapular artery. This is dorsal scapular nerve. Here this is the dorsal scapular artery and the spinal accessory nerve, which is supplying the trapezoid muscle. Okay, this is the transverse cervical artery, branch of the thyrocervical trunk. That is a branch of the subclavian artery. Okay, supraspinatus, infraspinatus muscle, teres minor, teres major, long head of the tricep, medial head of the tricep, lateral head of the tricep, deltoid muscle, latissimus dorsi muscle, thoracolumbar fascia. And this is the serratus posterior inferior, and this is the serratus posterior superior. And here this is the serratus anterior, this side. Actually serratus anterior you can clearly see from the pectoral region. Okay, thank you.